And I said, you call Dr. Robert. Day or night, he'll be there anytime at all, Dr. Robert.
So let's quickly review the characteristics of an illness related to Mars, which means it's going to come on acutely, it's going to be intense, it's going to be violent. You're going to know when Mars attacks. There'll always be a heat component related to it, meaning we may see it with the fevers, or we may see it with an acute inflammatory reaction, such as if Mars attacks Saturn, Saturn rules the bones, perhaps that old arthritic knee acts up. And when we see that Mars attacking Saturn, that knee becomes red, hot, swollen, painful, immobilized. You can't move, you can't walk because you're in pain. That's the acute nature of Mars. So it's going to be in your face. Symptoms are going to be intense. The pain can be anywhere from burning, sharp, stitching, piercing types of pain. So we got to keep an eye on it, but we got to stay flexible to understand that we may see Mars attacking, Venus. We may see Mars attacking Mercury, Mars attacking Saturn, etc. So we got to keep that flexibility and be able to interpret what we're seeing so we can find the correct indicated remedy. Perhaps in anemias, we always forget that, anemia is going to be a Mars-Venus combination. That dialect will always be playing out in the anemias, because what people forget to realize that iron has to be converted into the Fe3, into the ferric version, and you need the copper oxidase enzymes to turn Fe2 into Fe3, so ferric iron can be loaded into transferrin to be delivered to where it needs to go. So without the copper enzymes, you will become anemic. And behind the anemia, we will see most of the time it's copper. But we got to keep an eye on that copper-Venus dialect. Now, you could see symptoms with the mitochondria. It could be copper and iron, Mars and Venus, because we know with the flow of those electrons, they have to go through those iron sulfur clusters in the mitochondria in complex 1, 2, 3, and 4. And then iron's going to donate the electrons to copper in complex 4, and copper is going to be the final donator of electrons to oxygen. So we can see in all the mitochondrial disease that Mars-Venus dialect. Perhaps we can see it in the adrenals, because we know Venus rules the kidneys, Mars rules the adrenals, and who sits on top of the mound of Venus are the adrenals, Mars. And that's a dialect, because we got to see how those two organs are working intimately together as a complex. That's why in Chinese medicine, they called it the Jing. The Jing is the kidney adrenal complex, which they knew was a treasure. But what I'm pointing out, it's the energy of that Mars and Venus dialect playing out once again. We can see Mars-Venus related illnesses in the sexual arena, whether it's more mental, emotional, our fears, our phobias, our perversions, our repressions, or it could be the actual genital organs aren't working, where we're going to see that Mars-Venus component, that iron copper. So we got to stay flexible when we're looking at the Mars characteristics of an illness. If Mars attacks Mercury rules the whole respiratory system. And when Mars hits Mercury, that's going to be some, it could be an intense asthmatic attack. It could be a bronchitis. We'll see this very frequently in laryngitis, especially in children when they're in that 7-year Mercury cycle and they go into that 1-year Mars-Mercury cycle. We see that laryngitis so commonly and frequently. So that's some of the flexibility we got to have when we're looking at Mars-related injury. What other planet is showing its face? So that's where we got to be able to, just be able to interpret it intelligently, using common sense, using our wisdom, and then we can start finding the right, correct indicated remedy from a homeopathic perspective, because homeopathy is a branch of alchemy, and it's using energy, vibration, frequency to pass the blood-brain barrier to affect consciousness on a mental, emotional, and physical level. That's the beauty of it. That's why we need to understand the alchemical remedies that we can come in with, whether it's homeopathy, acupuncture, the Chinese medicine version, whether it's Reiki, some hands-on healing, Rife stuff. So there's many, many modalities that employ energy, vibration, frequency. And to me, homeopathy shines better than all. And that's why it stood the test of time. So what I find very fascinating in my practice is the amount of patients that come to me with removed gallbladders. First, we know Mars rules the gallbladder, and we see so commonly these gallbladders being yanked out on a dime. We need to have that Mars courage, that Mars energy to fight for our organs, because we don't want to go to the altar of medicine and have them just surgically remove our organs without having the courage to fight for our organs, without having the real resiliency and the temperament to say, I'm going to weather the storm when you're in an attack. Because once the organ's gone, it's gone. It ain't coming back. And what medicine will call is symptom shift, symptom displacement. So when you remove an organ or you suppress an illness, the symptom moves, the symptom shifts. So if you take out the gallbladder, now you're already stagnant, fatty, fibrosed liver is going to have to do twice the work. And as a result, that liver fire is going to rise. And we have too much fire, that's going to dry out the water element. And that will lead to every disease under the sun. So we want to fight for our gallbladders, because surgeons love to remove organs, or allopathic medicine, generally speaking, loves to remove our organs, whether we're taking out wisdom teeth, our tonsils, our adenoids, our appendix, our gallbladders, our ovaries. We're yanking out organs on a dime because it is profitable to the medical establishment. In fact, out of all the surgeries, every surgery poses a risk. But with the gallbladder surgery, that's probably one of the least risky procedures. And it takes them about 30 minutes to remove your gallbladder, and they're going to get a paycheck of about $50,000 in that 30-minute procedure. I want to fight for your gallbladder. So when I'm profiling a patient, I know you're in a Mars cycle, or I know that you're born in Aries, or you're born in Scorpio, or you're born on a Tuesday, or you're in a 7-year cycle. You could be in any of the 7-year cycles, and one of those years is going to be Mars. And so if you're in that 42 to 49 year group, that Mars energy cycle, then we got to be ready, especially if you have a predisposition to history of jaundice, history of bad liver function. Then we got to be prepared, because we need to come in with remedies so we can give organ support, or when we do have an attack, we can placate the attack so you can weather the storm and you'll come out on top. Also, what we notice with the gallbladder is the gallbladder and pancreas share that common biliary common duct. And so sometimes the gallstones can get into the pancreas, causing a pancreatitis. So we got to stay flexible to see how important this Mars gallbladder is. Now, also an interesting component to the gallbladder is most gallbladder problems, attacks, and issues with the gallbladder. Most commonly, we see it in married women with children. So now when we look at that population who get the most frequent gallbladder attacks, what it is about that married women with children. So this is where we got to understand it from an energetic perspective. So we got to look at gall is the gall of life. It has that aggressivity, that anger type of energy. And we know that bile is made in the liver. So the bile made in the liver, and that bile is a compilation of many things, of cholesterol, electrolytes, bilirubin, many, many things make up that bile. But the importance of bile and the movement and flow of bile is paramount to our health. And when that bile starts to congeal and get congested, then it behaves, where we're going to get those attacks. And we see it more so in women because there's something about the estrogens in bile. And then in a copper overload, copper can oxidize that B6 in the liver, because B6 is needed in the liver and gallbladder. In the gallbladder, that B6 helps to keep that bile in suspension so it doesn't congeal and get congested and form the stones. So in a copper overload, we can see this playing out. That's probably why we see it more so in women, is the estrogens, and that high estrogens cause that copper retention. So there may be many etiologies, but what's fascinating is the energetics behind it. So when we look at the classic married women with children, they're doing the work of everything. First they have to run the household. They got to make sure, the house is clean and they have all the stuff in the house, the groceries and etc. Now, also managing the children. You got to love the kids, feed the kids, dress the kids, be there for the kids. Could be one child, could be multiple children. Then you got to be there for the husband. You got to love him, feed him, dress him, etc. So the married women with children are wearing multiple hats. And what happens is, these family dynamics and these family situations can turn into obligations of frustrations. And it's this aggressive energy doesn't have a healthy outlet, then it congeals, and that congestion and that congealing of the bile becomes that phospholized bits of aggression that we call the gallstone. And that will cause an emergency situation, because when you get a gallstone, you're going to be bent over double, praying to the porcelain god, and you're going to be end up in the emergency room. In the emergency room, they'll give you a hit of morphine, and then they'll suggest to remove the gallbladder. And you won't be thinking sensibly or intelligently, because the only thing you're thinking about is, I'm in pain, get me out of pain, and you're at the mercy of the medics. So this is where we got to have that Mars courage, that Mars resiliency to fight for our organs. So when I'm profiling someone and I know that they're susceptible to gallbladder attacks, that they have a history of it, they have a lot of Mars in their cycle, or maybe they're in a Mars 42 to 49 cycle, I'm going to be ready for that. So when I'm looking for a homeopathic remedy, I'm looking for a liver remedy, because that bile's made in the liver. And then I'm looking for that Mars, aggressive, impulsive, zealous energy, that when it attacks the liver, that's our gallstones. So we may come up with some Mars Jupiter remedies. That may be chelidonium, lycopodium, arsenicum. And the quintessence of a Mars Jupiter remedy is nux vomica. Nux vomica is the hangover remedy, so it's great for toxic livers. And then we see the Mars energy of nux vomica, which is actually strychnine. The nux vomica mentals are usually kind of these zealous, overzealous, fiery temperament types. They're the aggressors, they're the type A's, they're successful in the work environment, but they're very vocal, very fiery. It's that Mars aggressive energy, and that's part of that Mars Jupiter liver. We see that remedy beautiful in that nux vomica homeopathic remedy, which may be one of the indicated remedies when we see a Mars Jupiter remedy, especially with the gallstones and the gallbladder and the toxic liver stuff. They're going to have a tendency for overindulgence in foods, overindulgence in alcohol, and they are prone to this liver toxicity. That's why that nux vomica is a beautiful remedy to make sure we have it in our repertoire, so we can be prepared for if we need organ support, if we need to get through an aggravation, a healing crisis, a retracing, emotional retracing, a Herx reaction. We're always going to have to be able to be ready for when we hit the speed bump, when we hit the brick wall, which is going to happen on a mineral balancing detoxification program. That's where we need the Mars courage to weather the storm, so we don't quit the program, so we don't end up in an emergency room with a gazillion drugs and an organ removed. We want to fight for the organs, because like I said, once that gallbladder is taken out, it ain't coming back. But If we weather the storm, we come out stronger, more vibrant, more vital. And that's the beauty of going through these aggravations. We want to make these aggravations doable. That's why we need the alchemy. The alchemy is a beautiful way to really get through whatever reaction we go through in a healing crisis.
If you're down here, pick you